Hello, everybody. Welcome to the HealthScore Conversations. My name is Aishwarya, the brand evangelist at CSoft Technologies, Bangalore. Today, we have Ms. Shabari Bhattacharya in conversation with us. Ms. Shabari is a professional counselor and a family therapist who has bagged all her degrees from the US and is currently working with the Green Oak Initiative by Annasawmy Hospital, Bangalore. We're very glad to have you in conversation with us, Ms. Shabari. Thank you very much for joining. Can you please explain us about this Green Oak Initiative?
So the Green Oak Initiative was something that was put together by a group of counselors, psychiatrists, and other mental health care providers with the idea of providing, comprehensive mental health care to clients who came in. Because often with mental health care, you need the services of a lot of different kinds of mental health providers. And that had started, and then the whole COVID crisis started this year, and it was decided that we would offer our services on a volunteer basis to doctors, nurses, other people who would be at the front lines of the whole COVID crisis, with the idea that any kind of pressure or stress that they may be incurring could build up, and it would be natural that they would be facing a lot of stress because it started out with them having fewer materials and equipment, and now it's it just progressed to people hearing horror stories or seeing horror stories or experiencing it firsthand, and having to go into work every day and provide the best medical care possible. So the idea was that by providing a helpline for them, they could call in and just vent, because the idea of having to face this chronic stress or this constant stress, it does take a toll on anybody, and it's normal to feel stressed under those circumstances. We just thought it would be a good idea to provide our services again in a comprehensive fashion, in an easily accessible way, so that they could reach out if they needed it.
It's a great initiative, Ms. Shabari. Thanks to you and your team for coming up with this. Can you also please let us know more about the key people who are working with this initiative?
Yeah, so the main people involved with the helpline are Dr. Ashlesha Bagaria and Dr. Soumya Krishna. They're both psychiatrists. Then there's Jwala Narayanan, who is a neuro rehab therapist. There's Purnima Mahindru, Priyanka and Vandana Ishwaran, who are all clinical psychologists. And then there's myself, who's a counselor. And then we have a project manager now, Suparna, who handles all our social media engagements and just making sure that things are running. And Shamala from CSoft Technologies has been helping us through this process and attends our meetings.
Thank you very much. So, Ms. Shabari, what are these major issues that our healthcare warriors are facing right now?
Yes, Aishwarya, that's a really good question, because as you may be aware of, the issues that our healthcare warriors have been facing has changed over the time that COVID has been upon us. And initially there was this fear of what they were anticipating, and we'd hear stories about what had happened abroad and what other countries were going through, with the knowledge that we had, or they had, access to less equipment. Ventilators may not have been available, PPEs may not have been available, and even nasal swabs, I remember, had at that time been something that everyone was concerned about. And with time, that has changed. That the access to equipment during the initial few months has improved, and they were able to get access. Now, over time, though, with things opening up and people having to go back to work or risking more exposure than they did in the initial months, our COVID numbers have gone up, and hospitals have ended up getting swamped. They've had to work long hours, longer shifts, and these are some of the things that we are seeing even on our helpline. When people call in, these are some of the concerns that they have, and this part of it is ongoing. I know cases may get fewer, but COVID for the foreseeable future is something that's on the horizon. So what that does to people, and what that does to the people who have to handle it, is it causes stress on a daily basis, and that ends up being aggravated over time, because if you are constantly dealing with critical patients who may or may not make it, there's a certain amount of uncertainty. It's easy to get burnt out. It's natural over time to have a stress reaction where you don't feel like, things are okay, that you may feel, people may feel sleepy, they may feel lethargic, they may feel stressed all the time, may feel sleepless. These are the longer term effects of having to deal with stress on an ongoing basis. And until COVID goes away as a pandemic, this ongoing stress will continue. And that is where we hope to be able to use our services, or to offer our services to help people better manage the stress over a longer term.
Thank you for explaining it, Ms. Shabari. I'm sure the Green Oak Helpline is of a great help and support for our frontline warriors right now. So while we are at it, can you please let us know how have you used technology in this program of yours?
Yes, so we use technology quite a lot in our processes. So Green Oak initiative was based out of Annasawmy Hospital, and they had implemented an online documentation system that we have used, and I believe that was provided by CSoft Technologies, and that helped us coordinate patient care with psychiatrists. If we were counselors working in the hospital, it would have been important to be able to see their notes and coordinate their care to understand, just the holistic patient's experience. Now, with COVID coming in and very few of us practicing face-to-face, I don't believe any of the counselors have actually gone back to the hospital. It becomes important to coordinate services online, and we've been using online software to do that. Our helpline, of course, we are all based at home, and we receive our phone calls at home, and the calls get routed to us through software, and so we just have to make sure we get online, and we change our phone numbers every time we're expected to be on call. So that has been a process, so we can receive those calls from anywhere, provided that we can be in a safe and quiet environment and have access to our phones or computers to provide resources. So that's been our services on the helpline especially have been possible because of various forms of technology.
Thank you very much. I'm very glad that our product was of a help for this wonderful initiative of yours. We're almost at the end of the conversation, Ms. Shabari. Would you want to share anything else with our audience?
I think one of the important things to know out of all of this, and as a counselor and a mental health practitioner, I think just being, letting people know that the COVID pandemic has added stress to everybody's lives. And initially it was something that was accepted that we talk about it. It was something that we were very much aware of the fact that our lives had changed. But as time has progressed and, everything has opened up, and most people have gone back to some semblance of what life was before, meaning that they were expected to go back to work physically, that, life has gone on, but yet we're still hearing that the hospitals are swamped, that the doctors are overworked. And so these two things have almost become parallel. And so people may not be fully aware of the fact that the stress still exists, and especially with those of us who are parents, or those of us who are dealing with children being home and having to manage work life. These things are continuous stressors. Now, for people who work in the front lines and are forced to deal with COVID on a daily basis, there will obviously be an ongoing stress, and that is something that has to be managed, or else what ends up happening is it's natural to be burnt out. And some of those symptoms of burnout are exhaustion, crying, anger, frustration. It often gets expressed to people who, family members or children or people who, are readily accessible. And to know that this is a normal reaction to a very stressful situation, but there is help to help process it so it doesn't get so bad, that people are able to avoid the burnout perhaps, and manage the stress on a daily basis, so there are no longer term implications of having to deal with stress at this time. But I just wanted to put it out there that I really admire everyone who goes to work every day and knows that they are putting themselves at risk. And this is something that, it takes a lot of courage and, just commitment and professionalism to be able to do that. There's no shame in saying that there's sometimes, you may need some help and to be able to deal with your normal stress.
Thank you very much for your time, Ms. Shabari. It was wonderful to have you in conversation with us. We wish you and the Green Oak Initiative a huge success.
Dear healthcare workers, your mental health matters to us. Please call 6366447484, which is a free confidential helpline. Thank you.